One of the conditions that I feel like I didn't do a great job of treating early in my career was posterior tib tendinitis. It actually took me shadowing a foot and ankle surgeon and actually seeing the surgery for this to really understand kind of where that pain kind of shows up. And oftentimes it's kind of lower calf, but right behind the medial malleolus. So that muscle kind of is deep and it runs behind the medial malleolus and it actually helps form an arch in your foot. So the people that I often see with this um, are people that maybe found running later in life. Maybe they were heavy, they kind of have a flatter foot, and they have an ability, or they're really flat-footed as adults, and this muscle becomes the tendon gets overly stretched because of the structure of the foot, and they have an inability to kind of control that posterior tib. So the exercise for this is I'm treating the left side here, and I'm actually trying to invert my foot, like bring everything up, and I should get like a cramping sensation kind of right along here, like in my lower leg on the inside, and then you want to slowly lower. So when I do this, I'm inverting my ankle, right? I'm going like this, and then I'm also going to add a little bit of plantar flexion at the end, and you get like this outpouching. You get that muscle kind of activating, and it's tugging on that tendon. You're going to hold, and then you're just going to slowly lower this down. I don't think posterior tib tendonitis gets talked about enough in the running community. I think a lot of people know about plantar fasciitis, Achilles tendonitis, and I think it's kind of a sneaky cause of lower leg pain. And you'll kind of see some people kind of struggle with almost like a shin splint like pain due to kind of weakness in this muscle. It just leads to overload. And this is a great way to kind of strengthen it and activate it. It's a little bit tricky, so sometimes this is a little bit too much tension. Crossover, sometimes it's a little bit too much tension. You can kind of tie a band around a stable structure, a dumbbell in this case. So I'm treating this left side, and what I'm gonna do is I'm gonna invert my foot and then plantar flex. So important to note, we don't want that kind of bunching up, right? So I kind of have it over my distal foot. I'm going to invert and plantar flex and hold and then slowly go back. So invert, plantar flex. You should feel it right in through here in that tissue right behind your medial malleolus. That's posterior tib.